Thank you.
Next, we'll hear from Councilmember Borelli.
Thank you. Appreciate it. Dr. Troxy, were you involved in forming the city's Key to the City policy?
Yes, I was.
I'd like to read something into the record from a document that the city's providing businesses and to the public on the Key to the City issued August 17th, entitled Guidance for Customers and Employee on Equitable Implementation of the Key to the City. Page 1, Section 3 reads, as an employee, you have the right to a reasonable accommodation to enable you to perform your job if you are unable to show proof of vaccination because of a disability, pregnancy, religious belief, or your status as a victim of domestic violence, stalking, or sex offenses. It goes on, page 3. If you're seeking a reasonable accommodation because of a medical condition or due to a pregnancy, your employer can request a note from a medical provider supporting your inability to show proof of vaccination. So the question is this is a document from the administration, so is the administration right when they say employers must provide reasonable accommodation for disability, pregnancy, religious belief, or your status as a victim of domestic violence, stalking, or sex offenses? Or are they right when, as the Chancellor indicate, employees won't be given exemptions and they're to be terminated or whatever the consequences?
Well, what I would say, Council Member, is that the Key to NYC and the vaccine requirement for Department of Education staff are two different programs.
Yes.
They do have different specifications, but both of them do have a common goal, which is the health, safety, and protection of New Yorkers.
And we can speak to your question. Lauren Siciliano can speak to that question.
Absolutely. Thank you for the question. Just specifically in terms of DOE, I think the language that you saw in that document refers to a range of federal, state, and local laws around reasonable accommodations. And we are, as the Chancellor said, working closely with our union partners and our city health partners to understand the parameters for those types of accommodations. But that language references general legal requirements around.
So just to clarify, did you say you're considering what accommodations that be made?
We are, as part of the impact bargaining that the Chancellor described, we're working with our labor partners and city health partners to understand the parameters for those.
Okay, so just for the record, the DOE is considering exemptions to make for certain employees for reasons listed in the city's other documents that I read.
Those refer to local, state, and federal laws that DOE is also required to follow.
Why? So the governor, the last governor, indicated that schools were much safer than so many other different environments, and I think, Chancellor, you said that as well, and I agree with you. So why was it safe to provide those exemptions to establishments that are under the licenses of New York City and not for the DOE? I mean, that's my question, but if you're saying you're considering that, I mean, I guess why wasn't that made clear?
So I don't have the specific language that you're looking at, but what it sounds like is that it's referring to a general suite of laws that employers like DOE are also required to follow in terms of instances in which reasonable accommodations need. So
do we know yet what will happen to a teacher who's not vaccinated on September 28th? No. So just to give like a real world hypothetical, a teacher who's pregnant with a note from her doctor claiming, you know, it's not in her medical interest. Frankly, I don't think it's your information. You need to know the information of why the doctor thinks that. But the doctor's saying it's not in this particular person's interest to have the vaccine. That person will be fired by the DOE, potentially.
If I may start on the medical part of it, Chancellor. First, I just want to make clear, Council Member, that we have a strong recommendation that people who are pregnant do get vaccinated. In fact, the CDC recently strengthened its recommendation about the benefits far outweighing the risks for vaccination for people who are pregnant, people who are.
But you said the risk. So is the risk level 0 for the vaccine? Not statistically 0, not almost 0. Is the risk level 0?
The benefits far outweigh the risk.
But the risk level is not 0. I know you don't want to say it, and I don't blame you. It'll probably cause a firestorm, but you know, to be clear, the risk level is not 0.
Council Member, as a doctor, what I would say is that all medications, therapies, vaccines They have some risk associated with them, but our job is to be very clear about the magnitude to which the benefits outweigh the risks. And with respect to the authorized COVID-19 vaccines, the science and the evidence is very, very clear that the benefits far outweigh the risks. This is both in terms of it being a personal defense against disease, as well as a community defense against the spread of COVID-19.
I agree with you 100%. I think people should get vaccinated. I think the benefits do far outweigh the costs. That's your job to tell us that, and I think you've done a great job. It's our job to weigh the risk tolerance and the level of intrusion government will make. That's what a legislature does. But regardless.
Folks, there's
Don't
ways,
cheer me on. I think you should all get your vaccines.
there are ways of expressing, folks, please,
Guys.
please. This is the council members' time, please. Thank you. Yes, Councilman.
So, just to go back to another question, I guess. What happens to the classroom again if a teacher is terminated or placed on unpaid leave or whatever the consequences is? You mentioned the substitute teachers pool would be implemented. Is it better for a student to have their continued qualified and licensed teacher, or an assortment of subs who may lack those qualifications and licenses?
I think it's important to note that we're in the middle of a public health crisis. And so it's better.
Folks,
It is-
again, please
So I
have
think-
respect for the people's house.
So I think it is,
This is a city council hearing, the Chancellor Health Commissioner here answering questions for families on the record. And folks, please, again, another outburst, and I'm gonna ask Sergeant at Arms to clear the room. This is really important for folks to hear. Chancellor, my apologies, please continue.
thank you. So as I said, I think it's important to note that we're in a public health moment, that we have to, I agree with you that it is more important to have a certified vaccinated teacher in the classroom with his or her class teaching those students. However, when we have to weigh health and safety along with our academic requirements to students, we have to keep them health and safety safe so that they can learn.
How many cases in New York City public schools last year while school was in session were found to have transmission from a student to a teacher or paraprofessional?
So I don't have that number with me, but the greater instances were around adult transmission.
Okay. But I'm just trying to establish, we don't, that's a number the city has? Or that's just a number we don't have?
Councilmember, we can follow up on that to see if we have specific data in the way that you're describing. What I can tell you is the city published a peer-reviewed scientific article on at least a portion of the last full school year, which showed that 78% of cases of transmission that occurred within the school building were from adults, either adult to adult or adult to children. So that means the balance was 22%.
So the estimate is 22%. Okay, that's fine. But we do have a hard number of how many diagnosed cases were from transmission in school, regardless of who the initial unhealthy person was.
We do have an estimate of that. In some cases, it is difficult to ascertain precisely what the source of transmission is.
But we have the estimate, and the estimate we're confident is worth it then to terminate or fire people based on it. In other words, it was so high that we've decided that it's worth firing the same people that we've asked to do tremendous, yeoman's work and God's work last year during the pandemic. So that number's high enough to justify their potential termination. It's a policy question, but we're policymakers. That's what I'm asking.
Chancellor, I'll start and then hand it over to you. I want to be very clear that the goal of the commissioner's order that I made, which is to require school staff to be vaccinated, is for health, safety, and protection. Our aim is to get all of those school staff vaccinated. to protect themselves as well as to protect their families and the school community.
I guess my final question. There's 50 states, dozens of large cities, dozens of countries with similar health departments and capabilities that resemble our own. And I'm assuming the leadership is all as qualified as you both, Commissioner and Chancellor, and I don't doubt you're qualified, and I commend you in so many ways for the work you've done. But with all that stuff and everyone digesting the same corpus of scientific research and data, there's still countless different ways people have structured their approach to COVID-19 and their response. Do you think politics plays a role in those choices?
What we're doing is opening a school system so that we can get our children in the places in which they learn best. And I'm not engaging in a moment of politics. I'm engaging in what I believe is important for children as a teacher, as a school leader, and as the leader of the largest school system in the country.
I mean, just given the fact that we have the state commissioner now, dumping on the last governor for not being transparent in health policy at the state level, are you suggesting that it's an unfair question to ask whether there's politics always at play in health policy?
I'm suggesting that Dr. Choksi and I have been working to open schools. And what we've done is really look at all of the science around how to do that safely. And so what I'm suggesting is that's what I'm prioritizing and focusing on.
Good. Thank you, guys. And as a parent, I do wish you luck. And I frankly, I hope you're right. And I hope you're right and I'm wrong. But thank you very much.